When Hamas seized control of the Gaza Strip in June of 2007, Israel responded with a closure of crossing points through which people and goods enter and leave. Palestinians claim that what they call Israel's siege of Gaza is creating severe mental stress for the Gaza Strip's 1.4 million residents. The Gaza Community Mental Health Program, in cooperation with the World Health Organization, organized an international conference entitled Siege and Mental Health: Walls versus Bridges. Its purpose was to describe the wider effects of the siege policy on mental health. But a few days before the conference was to begin, Israeli military authorities said that conference participants would be prohibited from entering Gaza.
I can only ask the Israeli authorities who made this decision to deny me and my colleagues entry permits, what do you have to hide? What are you ashamed that we may see? What are you afraid that we may say? There are no more secrets here.
A number of academics have nevertheless insisted on coming to the Palestinian territories, opting instead to conduct a conference in the West Bank city of Ramallah, where they explained the effects of the siege on Gaza residents.
In Gaza, you see many people with huge traumas related to the war activities, and at the same time you see an tremendous increase of general mental health programs, depression, psychosomatic illness, problems in the families, in the relations, and children especially are victims of this horrible situation.
The children who are really of the very greatest concern are frightened. Many of them have regressed, which is a term we use in psychiatry. They've gone backwards. Their bedwetting is very common. They are terrified. Many of them talk about not wanting to live.
At the same time, it has a tremendous psychological effect if they have contact. No contact means that they feel left alone and forgotten by the world.
It's impossible not to realize that the reason people have these mental health problems, is because they are under siege. Now, the siege is politically motivated by Israel.
Israeli spokesmen claim that when it comes to humanitarian issues, people are allowed to enter and leave Gaza on a case-by-case basis. But Israel claims that regarding the conference, this was not the case.
One has to be reminded that since the Hamas takeover of Gaza, the de facto power in Gaza has declared itself to be in war with Israel. The border is closed for any normal exchange, and only humanitarian activities are allowed. This meeting, this international conference, is not a humanitarian action. So in that respect, there is no reason to allow people to enter Gaza, even though they want to deal with medical issues, because this is part of the activities that Hamas is bound to exploit for political reasons, as they have done in the past.